We've learned how to transact with data and health information technology. We've learned to use and do all the accounting systems around it, but we're now just starting to learn how to really embed IT into the basic core processes of delivering healthcare, whether it's the providers out there, the last mile, when physicians are actually facing off with patients, making diagnostics decisions and making decisions around how they're going to deliver healthcare, or it's a payer deciding what's going to be on formulary or not, or it's a pharmaceutical company deciding where they're going to market their products, how they're going to have people use them, when they're going to be used, and delivering information around them. So that next journey that's in front of us around health IT is more fundamental around the core delivery process, the decisions involved, the various moments where healthcare delivery professionals have to really make life or death decisions on how they're going to treat patients. Collaboration happens at multiple levels within the industry. You know, we're all aware of the convergence between the payer, provider, pharmaceutical, the federal agencies are all becoming closely connected to serve the patient. The more interesting definition of collaboration would be between the patients, the physicians, and how they navigate the health system. So collaboration in its purest form that's really going to transform this industry is going to happen between enterprises, and we've got some conflicting objectives that are out there built into the system, and the collaboration between the physical delivery of caregivers, the healthcare delivery professionals, as well as the patients themselves. When the collaboration works between receipt of care, living up and adhering to the care, all the way through to the systems, and all the economic value is lined up to the patient, that's when it really is going to work. And that's what this next journey of collaboration or convergence is all about within the healthcare industry. First, a little bit about the research that PwC does. What we try to do is look at market leaders that are out there making things happen, that are really creating what we call impact on the industry itself. So we found some great innovation out there that people are really pushing the envelope around what they can do to improve the healthcare that we all deliver and we all receive. We didn't find the cookbook that exists out there. People are pioneering the next evolution of this. We're going to take out of these case studies, show examples to the industry and start to develop some common themes. So, long story short, we found a lot of people very focused, having impact, with some great success stories, with some patterns. The next step is to really take more of a commercial look at that and start what we see as this emerging economy around the whole informatics world that we see, and fuel a more aggressive growth there, and really use this research and some of the examples that we've seen to really spread it further across the industry so that we could see change happen even faster. I want to emphasize the fundamental cultural shift that's happening here. When we look at the industry, people get very quickly to the technology itself, and we know there's issues with there's a lot of technology players that are lining up to serve the industry. That's great. There's a lot of informatics data providers that are lining up, and that's great. And we all know there's some challenges around the lack of standards, the amount of data that's available, to make statistically relevant observations and predictions. But there's a much more fundamental opportunity out there to share innovation and to create that culture of continual improvement. Frankly, is something that the industry really is struggling with. I think we have a lot of interesting practitioners out there that are learning that they're part of a bigger system. And I don't mean a technology system or a computer system, but they're part of a bigger provider network. They're part of a bigger network of payers. They're part of a bigger industry that really has to embrace continual improvement, harvest this data that's coming out of our transactional systems, and really look hard at even making good things happen even better. And that's challenging. It's challenging for healthcare delivery professionals to take a hard look at how they're delivering healthcare and constantly ask the difficult and challenging questions. Plow into that delivery process new innovations and continual improvement. It's a culture that, frankly, we're just starting to understand. Other industries have done that, been there, and this industry needs to get a big dose of it.